Welcome, everybody, to take part in the iCON Chinese Health Forum. How's everybody doing? I'm Barbara Ho. First of all, I would like to do the acknowledge of land. We would like to acknowledge that iCON office is situated on the traditional, ancestral, unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. I am the Chief Nurse Officer of iCON Chinese Health Forum, and I'm the MC of today. Welcome, everybody. Welcome to the 2021 Virtual Chinese Health Forum. Take care of your health, Dementia 360. Give it a try, and later on, there will be different poll questions for everyone. And if you are joining us the first time, I would like to briefly introduce what iCON is all about. iCON is being initiated by UBC Digital Emergency Medicine. The main idea is to assist multicultural and indigenous citizens and patients and caregivers to optimize chronic disease prevention and self-management, and to provide reliable and relevant health information to citizens. We not only would like local citizens to take part, we would like to present such health information to further remote or even overseas people, so that we can work together to improve our health. And today, the topic is Take Care of Your Health, Dementia 360. Yesterday, actually, we already had held the first part. We tried to know what dementia was, what the symptoms were, what is early detection important, and what treatments could be offered. And today, we will look at, can diet prevent dementia? Food is very important to Chinese people, so this is something we can look at. And also, we look at the mental health of caregivers, because usually it is 24/7 taking care of dementia patients. So let us listen to the experts. Another thing is home safety. And also to learn what is community resources, what can we do to have planning, what are pre-arranged advanced planning, and there will be different experts who will be speaking on these topics to us.
Next, we have the second speaker for today, who is Wendy. Wendy is an occupational therapist, and today she's going to talk about home safety to prevent falls and slips and falls, to know the home safety issues for someone who has dementia, because a lot of people live with someone who has dementia. And so why are falls important to those patients, and how do you make sure that your home is safe? So Wendy has a lot of information to share with. So
okay,
Wendy,
thank you, everyone.
Wendy,
thank you, iCON, for inviting me to this health forum. And today we are talking about dementia, and also to understand the safety, especially safety in the household, and some practical tips that we should pay attention to. So just yesterday, we have already listened to some information about dementia, and there are actually many people being diagnosed of having dementia. And among us, 1 in 5 are actually taking care of patients living with dementia. And today, we would like to learn about 10 warning signs of dementia. First of all, the first one is memory loss, some kind of loss, and having difficulties managing day-to-day function, forgetting doctor's appointments, or forgetting how to cook, or even self-care. The ability is on the decline. And another area would find that there will be difficulties with language. We may be using an inappropriate word. And also when we go out, there will be disorientation, not just space, but sometimes time or direction. Another warning sign would be impaired judgment, cannot have a good grasp of the health condition. For example, on a day very, very cold, a person may be wearing short sleeves and be very thin clothing on a snowy day. And the next one is difficulties with thinking skills, more abstract things. So for example, on daily life, they have to take care of their bills, have to pay their utilities, and they cannot manage. Then there is another thing, sometimes we just don't understand, putting something in the fridge. It seems weird to place things in strange places, just like playing a watch in the freezer or in the sugar bottle or sugar jar. And also about emotion, just like Targeson was saying, there could be mood changes. For those who advanced dementia patients, there could be aggression and even hitting other people. And yet their personality may change. The behavior as well as the way of thinking can be very different. People may feel that other people are trying to harm them and that they may be paranoid. And for friends or family members, the symptoms may seem to be a loss of initiation to communicate with close members of the family or friends. So these 10 warning signs would be helpful for us to identify. However, when it's getting more serious and severe, of course, there will be examples of aggression. And when there are too many people outside, they may lose their way going home. And when it gets more serious, there will be hearing problem or hallucination. So what help can be offered? What is effective? Yesterday, we talked about some medication that can slow down the progression, but actually there will be some other alternative treatment to maintain brain health. The first thing is to do exercise, physically being active, and also be socially active. Now, of course, now we have social distancing, so go online, chat with a friend online, and also keep challenging our brain. If you don't use it, well, if you don't think from different perspectives, then the nerves and the connections are not being stimulated and they would not be further developing. And eating healthy is also important. And there is one thing important is to make safe decisions with the help of family members, trying to manage your stress. So all these, of course, cannot stop or reverse the progression of dementia. However, they can be very helpful to improve the quality of life and to slow the progression of dementia into the middle or later stages. For early stages of dementia, so there are help that can be provided at home, which we use every day to help them. For example, some calendars, journals, medication reminders that we can use on the cell phone or daily routine schedules. And there are therapists who can prescribe or provide brain exercises. For example, spelling games. Some other people can do puzzles or Sudoku or memory games. And we can also use tablets or smartphones, and there are apps that can be used. You can also give it a try to do some of the following activities, like playing mahjong. This is a very good help training our brain. So after all, challenging our brain with different means would be very important. And at home, we can also have things that we can find in our lives, like digital clocks, or you can have a whiteboard on the fridge, writing down all the appointments, what people you have to see, or even you can write down the grocery list, the shopping list, all the activities that you have to manage as a reminder. For more advanced dementia, they may lose the ability of making phone calls. But actually, you can see on the markets, there are phones where there are pictures on the phone, and they can just press on the picture and then place a call. And there are even more advanced technical devices. You can put it in your keychain, your handbag, or your cell phone, and it will be easy to track down the patient. And there is one old school thing, which is the voice recorder. And for even advanced dementia patients, they may need something called a memory book. As family members, of course, it will be helpful to keep something which is important to the life of the patient. For example, the place where they lived, their favorite pets, their favorite music, their favorite movie. So after all, anything that is meaningful to the patient, and making a memory book so that they can be further reminded. And about technology, we have mentioned about smartphone. There are different apps. Some can help us to train our brain, and other apps can help us to do meditation so that we can manage stress. And some can help us to locate our location so that we don't get lost so easily. And memory strategies, what can they be involved? So most important thing is when you are working on things, try to minimize distractions, shutting off the TVs, radio, so that you can be paying more attention. And a function that you are doing, try to simplify it. Also for daily used items, put them in the same location so that you don't have to look for them. And routine every day. If you could keep a routine doing the same thing at a similar time, then you can simplify your life. And I think some of you may already be doing this. Now, for example, writing down journal, or you're jotting down some experience, some fun things or your thoughts so that you can return to when you're at home. So there is, you can play a reminder on a certain object so that the family member can find that more easily. And for some patients, they even have difficulties locating the toilet. And you can mark it, and you can place, or you can paint the toilet door totally in a different color so that the patient may remember, say, yellow is the toilet. And another thing is to set a routine. So try to simplify your life so that you repeat the similar things from day to day. And for moderate stage patients, they may have difficulties to remember the steps of putting on clothes. And the family members try not to do everything for them because patients require further stimulation and training. You can give reminder, for example, oh, what is the next thing? Do you think you should put on the coat? Do you think the next step should be buttoning up? Then providing these reminders, because use it or lose it. Otherwise, they would further lose their function. And for later stage dementia, then family members may have more hands-on help. For example, clothing or going to the washroom or even mobility or feeding. So during this stage, the mobility of our patients will be more challenging, and it is possible that they will be on wheelchair. And during this stage, family members have to learn how to safely prevent falls and to help patients to safely transfer, say, from the bed to a chair or from the chair to the toilet. Sometimes the therapist would prescribe activities or exercise for the patient to maintain their ability of motion. And for the caregivers, you can help the patient with the exercises. And with a language, there would be books that you can help make communication. And if they have difficulties communicating because of the muscles in the mouth, they can point to the pictures. And at home, there are different facilities you can obtain on loan from Red Cross, and your therapist or doctors can give you prescription. So when it comes to a time that you need it long term, then you can consider purchasing them. At home, there could be installation of things like grab bars. It would be a common place for slip and falls will be the bathtubs. So have grab bars next to it. And also there are different lifelines at home. There is one type that offers GPS and where you can put on your body like a pendant. So even when they have gone out, they can ask for help. Another thing, of course, it will be used automatically turned off utensils or small devices like electric kettle. And there are even locks for those oven or stoves. And for day-to-day function, prevention of fall is very important on the stairs or walkways. Try to remove all the clutter and try not to have small mats or small on the floor, because it will be an easy means for people to be tripped. So tape them down onto the floor. And it will be good to install night lights on the walkway or the path towards the bathroom so that they can see clearly when they approach the bathroom. And about the kitchen, it is important to place the heavier things on the bottom and then place daily use items on waist level so that the patient does not have to bend down to get objects. And sometimes we do need to pick things up. So it would be good to use a reacher or ask family members to help. Another thing which is important is after you have spilled something, it's very important to immediately wipe it up with a long handle mop. And at home, it's much better to wear shoes. What about outside? Days like these is wet, or sometimes it can be snowy. So very important is to clean up the walkways. About exercises, well, every week there should be 150 minutes of moderate to vigorous activities. So these could be walking quickly, or swimming. And in Richmond, there are organizations which provide assistance with exercises. So there are community programs which offer 20 minutes of exercises. In Richmond, the fall prevention initiative, you can register with them. And also Alzheimer's Society would offer activities that you can do online. So you can go online to reach all this information. So if unfortunately we have a fall, so what should we do? The first thing is to stay calm. And if you've got things like a lifeline, of course, press and call for help. And if you have a whistle, then blow it. If you have a cell phone, try to call. But when you discover that you are not really injured, then you can try getting up slowly. First of all, look for a sturdy piece of furniture. And afterwards, try to use your stronger leg and to support yourself, and then support yourself using the furniture and get up. And after you have set yourself down, it is very important to give yourself a few minutes to calm yourself down before you try getting up to walk. And today we have shared what I have prepared, and I thank you very much for your attendance. Thank you, Wendy, for giving us such thorough information. And we thank all the audience to pay attention to our program and to listen to all the specialists giving a lot of information. I would like to acknowledge a few of our partners. I would like to thank BC Health Ministry because of their support. And therefore, our iCON has been in operation for 13 years, and this is our 14th year. A lot of gratitude to them. And this one, please go to BC Health Ministry and go to the booth. So there is one which is the guideline for seniors, and you can download for them, Seniors Guide, and they are in English and in Chinese. Two different versions. So please go and take a look. And then another slide, please. And there are a lot of community partners like Success, which is very important, and Alzheimer's Society BC. We have a lot of support for them. Vancouver Coastal Health and Canadian Health Association, Canadian Health, British Columbia, and Villa Cathay, and Richmond Cares, Richmond Gifts, who is helping us. And there is a lot of media partners, Fairchild, Ming Pao, Sing Tao, Talent Vision, Fairchild Radio, South Vancouver Neighborhood House, Diversity, and IMC, and also Kawa Health Forum. And finally, I would like to give thanks to the health exhibitors. So remember, these health exhibitors are on for 1 month, and you can go through the Success, Alzheimer's Society, just like what I've said, the BC Ministry of Health, Family Givers, RCRG. I would like to also say Success and Alzheimer's Society. They are offering another forum, and then from our exhibition forum, you can find a poster. This is the one. So you can take up your phone and then take a shot of the QR code. If you're interested, I think there will be a lot of information to present to others. And finally, I would like to express our thanks to our guest speakers again. And you have been attracted by their excellent speeches. Dr. Tigerson Young, Wendy, our registered occupational therapist, Jojo Wang, registered dietitian, and Miranda Wang, community psychiatric nurse. And so the information is excellent and abundant. And we would like to thank Sea2 Sky Christina and her team to organize this virtual forum. Thank you very much for their technical support. And there are a few interpreters. So when you listen to the Chinese or the Mandarin, so you can listen to Shiny Tang Susan Yao. For English is Josephine So and Benny Loy. And thank you for the enthusiastic interpretation. And thank you so much. And finally, I would like to thank iCON team. Actually, behind the scene, there is Susanna Ng, there is Joanne Rockwood, Henry Soring. They have been doing a lot and having a lot of support to us. And there are many other volunteers behind the scene giving us a lot of help. And finally, I would like to thank Barbara. You have seen her performance in the past 2 days. So not just those past 2 days, there was a lot done by her preparing for the forum. And the most important, I would like to thank all of you, audience, because when you come to this forum, it's because you take very important perspective at your own health and the health of your family. And we really do wish that we have helped you to know more about dementia. And we do hope that we are going to hold more workshops on different topics. And we know that there are a lot of questions regarding dementia. We are going to hold a specific workshop answering all those questions. So please go on to our website, keep track of our development, and then you will be notified if you have already registered. And for online, I have to say goodbye for the time being, but I know we are going to have a good time down the road, and we are going to use time to help yourself and help each other so that we can live a very vibrant life. Thank you. Bye.